You are listening to the HealthManagement.org podcast series. Dr. Donna Prosser, Chief Clinical Officer at the Patient Safety Movement Foundation, talks about the key components of creating safe and reliable healthcare.
I'm Dr. Donna Prosser. I am the Chief Clinical Officer at the Patient Safety Movement Foundation. And, I think that the ideal healthcare system of the future is one that is highly reliable. We've been talking about high reliability in healthcare for a long time. And we really have done a lot of fabulous things over the last 20 years to make healthcare safer. And for those of you who have been in the healthcare space for a long time, you know that highly reliable organizations are those who can go for a really long period of time without having an error of some kind. So that brings to mind nuclear power, aviation, the oil and gas industries. And we've been trying to learn from them for many years now, but we still have quite a long way to go. So I do believe that it is possible for us to get there. I do believe that we can have as standardized of a global healthcare system in healthcare as we do in aviation. If you go to airports around the world, it's very consistent. The safety components are the same. So again, we're doing a lot of things that are right, but we need to build on those high reliability concepts. Here at the Patient Safety Movement Foundation, we believe that there are really three critical components to safe and reliable care. The first is that we have a person-centered culture of safety. And what that means is that we are concerned with the safety of everybody that goes into a healthcare organization. That's patients and families, but it's also visitors, clinicians, frontline caregivers, folks that work in the billing department, everybody we need to be concerned about the safety for. And that safety is top of mind, that there's transparency and openness, and that all of us have the opportunity to be able to speak up when we think that something is wrong. The second component that we believe will build on a highly reliable system in healthcare is having a holistic continuous improvement framework. Now, again, we've been talking about continuous improvement in healthcare for many, many years. In some organizations, they do a really good job in improving care in a specific population. But what happens very often is that after we've improved the care in one particular population, we change our focus to a different area. So for example, perhaps we were working on healthcare associated infections before, and now we've shifted to reducing patient falls or to reducing readmission rates. And so then the previous effort fails because it's not sustained over time. And the reason for that is very often the right hand doesn't know what the left hand is improving. We have different committees that are working on different things and across the entire organization, and we're not looking at improvement at the ecosystem level. We are looking at it at the microsystem level. And so that would be the second component that we need to build upon in order to become more highly reliable. And then the third component is having an effective model for sustainment. Very often we have education systems in healthcare within a hospital or a healthcare organization that work very separately from the quality improvement work that is happening. We have to integrate that work and make sure that we are constantly building on the improvement work that is happening by reinforcing that through our education methods. So, again, I think that we can get there. I think it's going to take a lot of work on our part. At the Patient Safety Movement Foundation, we do believe that zero preventable harm and death is possible. As a matter of fact, that's our vision, that we will achieve zero preventable harm and death by 2030. But that's only going to happen if we all work together to improve this at the same time. So, we believe at the Patient Safety Movement that there are three things that we're going to focus on. The first is forging relationships with people across the globe. So everybody on this call, and every professional organization, every healthcare organization, every clinician, patients, families, policymakers, we all have to join together to be able to make this happen. We also provide education for free for patients, families, clinicians, and administrators available on our website. And then the third thing that we have to do together, again, is create that public demand for high reliability in healthcare, just like we did in aviation 50 years ago.